Dr. Wang, I found that he could actually expand my ribs, do rib expansion. So then I found your email on YouTube, and I started emailing you. And the rest is history.
The patient originally suffered from pectus excavatum. Prior to this surgery, the patient had undergone Ravitch procedure and Nuss procedure to treat pectus excavatum at the age of 5 and 21, respectively. But contrary to expectations, both surgeries did not correct the deformity, but instead made it more severe, even causing the chest to gradually narrow, ultimately developing into secondary, thoracic dysplasia. To improve the appearance of the chest wall, the patient subsequently underwent a third cosmetic surgery and had 2 prostheses implanted. However, cosmetic surgery cannot truly cure the deformity, and the narrow thorax may eventually affect the patient's cardiopulmonary function and bring serious consequences. So he had to undergo a 4th surgery to reconstruct and expand his entire chest wall.
The first few days after the surgery were pretty tough. A lot of dizziness, a lot of weakness. It was tough, but I made it through. And then each day got better. Still a little bit of pain in my upper back, but it's manageable. It's getting better. And so I'm just gonna take one day at a time. And it looks a lot better. It feels a lot better. I'm able to take deeper breaths. Surgeons in America, I was just getting pretty, what's the correct word? Like, kind of down and out about my future because the doctor who put the Nuss bars in, I asked her like if anything else could be done to expand my chest, and she was like, unfortunately, nothing can really be done. And so then I did more research on the computer. And I found another pectus specialty in North Carolina. And he looked at me, he reviewed my CT scans, and he was just like, I don't know what to tell you. Unfortunately, nothing can really be done. Like, it's just, but you do have to, get a cardiologist, get a pulmonologist, and go see them every year just to make sure you don't, because you could probably develop early onset heart failure and pulmonary hypertension because your ribs are compressed. So I basically just have to live until it gets bad. And that really put me down. Like, I was just like, I don't want to,
live his life like that.
And so then I did some more research, and I found a couple of doctors around the world. Like, there was one in Germany that could maybe do some stuff, like lift my sternum up a little bit, but not expand my ribs. And then Dr. Wang, I found that he could actually expand my ribs, do rib expansion. So then I found your email on YouTube, and I started emailing you. And the rest is history.
I'm very grateful for Dr. Wang. Ever since my son was born, we tried right away to try to get it fixed. And they told us we had to wait until he was 5. And then, so we had that done. And then later on in life, my son, it really bothered my son. And he didn't really share it with us. So we found another doctor in another state to put the bars in. And that's when we found out that what they did when he was 5 years old wasn't a good idea. and that's what caused this problem. And so then now he researched. He's 32, and we're finally getting it fixed because of Dr. Wong. And I'm glad my son was able to research and find him.
And I was talking to one of my nursing friends back in the US about how America should be more like China, because then it wouldn't cost so much, like, because in America, like, the patients expect you to, like, the nurses to bring you towels and some food, all this kind of stuff, and it's like, yes, this is just more simple, costs less, so yeah.